government has stated very clearly that family-based care is the preferred care option for all children in Zambia, including children living with disabilities. Care reform has taken on a transitional process. Through the years, we've noticed a breakdown in a traditional extended family system that typically took in children who are vulnerable due to poverty, due to death of their parents. So that was like a safety net where these children could be cared for within a family setting and within their communities. But unfortunately, with HIV/AIDS, as the nation was grappling with HIV and socioeconomic meltdown, poverty, we saw an increase in vulnerability at family level, which led to the need to establish childcare facilities in Zambia at that time. And there was a drive or a push towards children being admitted into these childcare facilities. The good part is that our government has shown strong political will in promoting family-based care for all children here in the country, and they have established a very strong regulatory framework that is reflected in our laws and policies that promotes reintegration of children from childcare facilities back to their families, and also looks at other alternative care options such as foster care and adoption. And over the years, we've seen an increase of families taking back children from facilities back into their families, and also an interest around foster care and adoption from various families within various communities.
The Zambia Association of Sisterhoods, commonly known as ZAS, is an umbrella body for all the women religious here in Zambia, and it was founded in 1958. It consists of 46 congregations with a membership of over 1,500 sisters, both indigenous and missionary sisters. So the association runs a number of programs and projects, and the CCZ, which is Catholic Care for Children in Zambia, is one of the projects that is running under ZAS. So through the Catholic Care for Children in Zambia, the association takes a proactive role in promoting the well-being of children in Zambia, particularly looking at issues of child safeguarding and protection. But again, the project promotes the family-based care as the best environment for nurturing the growth of a child.
Issues of changing the community attitude and mindset borders on sensitization activities that we have been undertaking through radio and also face-to-face interaction with the community. And I think under the Catholic Care for Children project, where we are working with the collaborating partners and also Children and Families platform, we have been able to air some sensitization activities on radio. And what we are getting now as a feedback is that the community perception is slowly changing. They are now receptive to getting their children back into their families. And I think we are seeing more also positive response in terms of really promoting family-based care and life-based children into institutional care. So it's a gradual process, but I think we are getting there because we can now say that the community is really supportive of our initiative of placing the children back into the families. Internally, actually, we can say the challenge has been really to make our religious and the clergy to buy into what we are promoting. But of late, I think we are seeing a really concerted effort also by our regional bodies and ASEA, and also the national conferences that are also engaging our bishops and the clergy so that they can be able to buy in. At community level, I think the challenges were around really issues of poverty that are really like the driving factors for placing children in institutional care. So we are doing some economic strengthening in order for us to make sure that families have the ability to care and also to provide. So I think these are the main two challenges we hope that as we continue with our interventions, then we can see much more areas of impact and positive growth of children in family environment. Yeah, mindset change is a long journey and it's a process, so we still feel that we need to still continue sitting around the table, dialoguing around the best way of living, like transitioning, so that most of the childcare facilities can be providing support at family level, at household level, and we hope that also the partners that are really helping us in terms of material and financial resources can continue supporting this cause and the interventions that we are making, so that at the end of the day we can all see that we really remove a number of children from institutional care to family-based care. So we still need to continue really engaging one another and all the different stakeholders, including government, so that we speak to the care reforms.